I'm gonna talk today about how the CAD/CAM dentistry changed dentistry for us, for the lab, and for the practice as well. So let me introduce myself. I'm coming from a small city in the island of Crete in Greece. It's called Chania. It's a really nice place. When things get better, you should visit. This is our lab. We have focused on the CAD/CAM technology for the past almost for the past decade, with CNC machines, printers, scanners, and everything. So how did it change my daily life? It made things faster, made things more predictable, made things more accurate, and of course more efficient. What has changed? We have replaced casting with milling. PFM is not our most popular restoration anymore. We have a great variety of materials to choose from that suits each case that we're doing. The diagnostic workshop is done digitally for the past 2 or 3 years, almost 3 years. And implant placement has become easier for the surgeon with all the tools that now he possesses and he can use. Really important for me, for our lab, is the provisionals. We're doing lots of them. So the mid provisionals, they are more durable and more aesthetic than the old school ones. And of course, something that is often overlooked is the ability to have a great archive of our cases in just one hard drive. For me, it's really important, this one. So, full contour zirconia is the most popular restoration in our lab nowadays. We have a higher success rate than compared to traditional PFM, and it's comparable only to our lithium disilicate one. And of course, most of my clients, they are from other cities or other countries. So for me, efficiency is a really important thing. And when I say efficiency, I'm talking about the restorations not coming back in the lab for any adjustments or corrections. Of course, some of them, they do come back, but we have solved any problems like occlusion or contact points and stuff like that. Okay, we can miss the shade, but more or less we are sending the restorations and they are getting fitted, so it's a good thing for us. I mentioned full contour zirconia. It doesn't have to be cheap or look bad. I personally am not charging much less for full contour compared to my layered ones, because I'm using some systems that they are practically not traditional staining. All these cases are full contour zirconia. Even this single central is full contour zirconia, upper right of the patient, number 11. Of course, it could have been better, but I think that it is a really acceptable result. And for this case, the funny thing is that I also did the layered one, and the full contour one was better. So it was a blow for my ceramist ego, but it saved the day. In this case, we all know how difficult the single centers are for the technician. And the provisionals I mentioned, this is a full upper arch, the initial situation, and this is the design I did for the provisional. And this is the final result in the mouth, right after placement. Provisionals, they're a headache for me because I used to dread the moment when a provisional case was coming in the lab, because it's a case that I cannot charge much. It's a case that I have to do really fast most of the times, and it doesn't make any sense. as business for the lab. Now with the mill provisionals, I have no problem doing provisionals all day long. And the diagnostic wax up. I'm not a fan of hand waxing. I'm not good at it. I'm bored. I'm slow. I don't like it at all. And of course, we have access to milled metal frameworks that, in my opinion, they are the only acceptable metal framework for implant cases, such as this one I'm showing you now, because no way I could cast this frame and have the absolute passive fit with a casting machine and chrome cobalt, let's say. So we used to have the silicone impressions. They worked really nice. They were really reliable for years. But for the past 15 years, maybe we got introduced to the intraoral scanners, and they have evolved from their initial stages to really nice and reliable devices we have today. So as everything in this life, there are pros and cons. They are fast. We can have communication almost instantly with the dentist, and the dentist with the lab. The dentist can self-improve him because of he can check his preps under magnifications. Excuse me. So and of course it is really efficient for the whole thing. If you ask a patient if he will go back to silicone after he has been introduced to intraoral scanner, I bet that he would say, no way, I'm going back there. And of course, again, the digital archive. We can visit a case we did like 2 or 3 years ago with just a few clicks. The cons, it's of course the cost of purchase, the running cost for some systems, the learning curve. A dentist that has been practicing for 10-15 years, he has to learn something new and reinvent himself, maybe. The lab has to have additional equipment like a 3D printer or at least a design station. And we don't have proven accuracy for full arch cases on implants yet. So this is a case I did with Dr. Dunis in USA. We received this digital impression here for a 6 implant case. So this is my design. I started designing after I imported the files in the CAD software. We can see here that we had some issues with the screw channels on the buccal, so we used angle correction T-bases. This is the provisional design. We can see here, use the virtual articulator, everything goes as planned. This is the finished bridge, milled PMMA. The printed model where the bridge is seated. And the provisional bridge placed right after placement in the mouth. So 3 months later, the patient was happy, the shapes, everything was suiting him. So after I received the final impression for our case, I just had to copy my initial design for the provisional. So I did. We decided to split the case in 2 bridges, and I would layer on the buccal side of the zirconia frame. This is the zirconia frame right before sintering. This is right after sintering, seated on the model, and after my layering is done. We can see here how nice Dr. Dunis has shaped the soft tissue. And this is the bridge. Here the bridge is right after placement. But not all cases are implant related. The bread and butter stuff, the everyday stuff, is most likely posterior or like small bridges or singles or whatever. So this is uh, a case of single molar from an intraoral scan, full contour zirconia, and this one was also made modelless and placed in the mouth, no adjustment needed. This is what I love about intraoral scanning. We can get really nice accurate results. A case here, a young female, she wanted to improve the two centrals, get all the information needed from the dentist about the shade, the stump shade. He sent me the intraoral scan, a really nice one. The model, the design of the cores. I fully layered these two crowns here. This is right after placement. This dentist is based in Cyprus. I mean, distance doesn't count. Another client of mine, Dr. Stavros Pelekanos, he's in Athens. Really great prosthodontist, terminal dentition. The provisional, some clinical stages, the screw retained provisional and the tripod provisional before the placement. These are the scan bodies, intraoral scan. You can see here, I have all the information I need. I have the provisional, I have the video, I have everything that is needed for me. I followed the initial design of the approved provisional. I added two cantilevers. Then we could just share a screen and discuss the case, no matter the distance. So we don't have any limitations. So we discussed the case. We decided that we would do some changes. For an example, you can see the cantilever molar here. That it would be an issue. So the lower molar, which was in schedule to be extracted, it was extracted now. You can see here on the upper right image that we digitally extracted the tooth and made a proper cantilever molar. This is my design with a facial cutback. The patient requested a natural look, so we had some little crooked teeth. We used also here some angle correction T-bases. I printed a prototype. You can see on the upper left image, just to make sure everything is like I wanted them to be. Then I proceeded to the milling of the zirconia frame. This is right after sintering. And this is after I finished my layering. You can see we have a plaster model because it was the model that was used to make the provisionals. So I requested the model so we could verify the accuracy of our scan. This is our patient at the trying. When I saw the pictures, I said to myself, "Oh, really nice. We have a good result." But then there are some little things that need to be improved. Some embrasures, some of the papilla And this is right after the corrections I made, the final. This is the final case. We can see here they're nicely shaped soft tissue, and the bridge right after placement in the mouth. No surprises, no nothing, and the final result here, and our happy patient. Another case, this is most my standard, more or less protocol we are making. The digital wax up, we are using provisionals. As for this case, we increased the video a lot. It was a class 3 that we wanted to maybe transform to something more, you know, like a class 2 or something. And this is the final result after having the provisionals for 4 months. We changed three sets of provisionals for this case. And of course, no matter how big or small the cases are, this is a case we have with some eating disorder. You can see here the severe wear of the teeth. This is the digital wax up, the printed model here that the dentist used to perform the mock-up, and this is the final result. Pretty easy to follow our plan. This is almost full contour. I use some Mio on this one. Patient didn't want any intense like translucency or effects or whatever. And then this is my first. This is my second full arch on 6 implants, fully digital case. We can see here the initial situation is really bad. This is the provisional. Again, a case with Dr. Pelekanos. I utilized all the weapons in the arsenal. I used the photos for the design because we had a patient that really wanted to have like the demand was really high. Her demands were really high. So this is my design following the provisional. Again, a printed prototype, so you can see that it is on my standard protocol that I am using all the tools that I have at my possession about the planning and the checking and everything. And this is a printed prototype that it is supposed to be tried in the mouth so we can check some things. This is the prototype in the mouth, and after the patient had this on for about 10 days, she told us what she liked and what she didn't like, and we saw some things that we need to correct. For instance, I removed the pink from the incisors and some slight changes. So this is the finished case, the finished arch after I made the build-up. Again, really nice soft tissue, and the bridge placed in the mouth, and the final result. Another aesthetic case, again a fully digital case, scan bodies, provisional, my design. This is the final design of the frame. After I finished my build-up, the printed models here, you can see. And this is right after placement in the mouth. A great result, again with Dr. Pelekanos, who was responsible for this amazing contouring of the tissue. but not all cases that digital. I'm focused on implant cases, but there are sometimes I'm doing also some aesthetic stuff. Like in this case, we did some veneers for this young person, young male, 23 years old. He wasn't happy with what he had. You can see here he has some issues. So, like a broken record, we begin with the same protocol. Digital wax up. Just here is, you can see the digital wax up. This is the printed model. These are the preps from the dentist. So I'm using my wax up as a reference since it was approved. You can see here the preps, the initial situation, and the wax up in one picture. It's really nice. You can it helps you to evaluate things. The design on the preps. So I'm having milled wax. I pressed it. This is a lithium disilicate, and this is right after I finished layering. Some more pictures here. And this is 3 weeks after placement. We can see how nice the gingiva responded to our treatment. This patient wanted bright but natural look. He was really happy. I'm happy with this one as well. I believe that I managed to give him what he wanted. And this is our happy patient. Really great guy. So, thank you for watching. Stay safe. We will get through this stronger, I believe. If you have any questions or any comments or just want to chat, you can visit my webpage, send me an email, or contact me directly through Facebook. I'm really looking forward to seeing you in my home city if you can. And of course, don't forget to donate. It's a really great cause. Adam and the rest of the guys are doing such a great job, and let's just be solidarity must be our word of the of this time, so we can help those that are in need. So until next time, have a great time from me. Bye bye.